The IAB Catheter kit comes packed in a single box with all components ready to use. The kit contains 4 components plus an instructions for use manual. Please read the instructions for use manual very carefully. The 4 components of the kit include the accessory tray, the main tray with the balloon, a Datascope adapter and an Arrow adapter. The accessory tray comes wrapped in a double Tyvek pouch. The tray has a clear plastic lid which must be removed. It is released by pressing the 2 lateral tabs. The kit contains access needle, dilator, sheath, guide wires and pressure tubing. The main tray also comes double wrapped in Tyvek pouches, but does not contain a lid that covers the tray. This tray contains a 60cc syringe, a one-way valve, the balloon, which is protected by 2 sheaths. Here you will find the serial number and important instructional information. There is the Datascope type adapter and the Arrow type adapter. The accessory tray contains an 18 gauge access needle, a standard 7 French dilator and access sheath. Any 7 French sheath can be used with this balloon. Note there are 2 guide wires in the kit. There is a short 35 thousandths guide wire. This is to only be used for introducing the sheath. It will not pass through the central lumen of the balloon. The second guide wire is 150 centimeters by 25 thousandths. This is the guide wire to be used with the balloon. Note the 2 different guide wires. Remember, our guide wires are standard, so clinicians can substitute them with their preferred guide wires if they wish. The kit contains a pressure line with a 4-way stopcock. We supply a standard length of pressure line extension tubing. If clinicians require a longer tubing, they can replace this with standard pressure lines. However, adding longer pressure lines induces more noise and more signal drop. Our pressure lines all have standard Luer lock connectors. The setup is for any standard fluid-filled pressure line. Make sure that the Luer locks are secured tightly together. Our pressure line attaches to any standard transducer kit. Hospital staff will be completely familiar with how to set these up. Setting up the balloon. Warning: you must never inject air or gas into the central lumen of the balloon. Remove the one-way valve from the kit. This will be used to maintain a vacuum in the balloon. Caution: never remove the wrapping unless a vacuum has been drawn on the balloon. The valve is simply connected with a push fit pink to pink. There is an arrow to indicate the direction of the draw of the vacuum. The 60cc syringe is pushed into the one-way valve and about 15 cc's of vacuum are drawn. Excessive vacuum should never be drawn as this can damage the balloon. The syringe is removed, leaving the white valve attached to the balloon. The vacuum prevents the balloon from prematurely unwrapping when the first sheath is removed. The balloon will not pass through a 7 French sheath if there is no vacuum in the balloon. Carefully remove the balloon from the tray. There are two protective sheaths for the balloon, a clear one and a grey one. The clear sheath will be removed first. Note that from the V-hub there are two exits, one for the gas and one for the central lumen. The packaging stylet must be removed from the central lumen before the balloon can be used. With a vacuum drawn and the stylet removed, the first protective sheath can be removed. The second peel-away sheath can be used to assist with inserting the balloon. For use with the sheath, the long guide wire must be placed through the sheath when it is in the patient. The guide wire can then be backloaded through the central lumen of the balloon. Only a 25 thousandths guide wire should be used through the central lumen of the balloon. Note how the peel-away sheath helps with easy insertion of the balloon into the sheath. If the peel-away sheath is too far away, the balloon will bend. Advance the sheath to make balloon insertion easier. As you insert the balloon, gradually pull back the peel-away sheath. When the balloon is fully inserted, the sheath can be opened and peeled away. For sheathless insertion, the guide wire will already be inserted through the balloon. To aid with insertion, the peel-away sheath can be pushed close to the incision site. This will help with balloon insertion. Once the balloon is fully inserted, the sheath can be peeled away. Following insertion, back bleeding will be seen from the central lumen. The guide wire is removed and the central lumen pressure line is attached. Ensure all luer lock fittings are securely tightened. Position of the balloon in the aorta must be checked with imaging. There are two radio-opaque markers on the balloon, one on the catheter and one at the soft tip. Caution: the one-way valve must never be removed until the balloon is correctly positioned within the aorta. Select the tubing set that has the correct type of adapter for your pump. Tubing sets are specific to the balloons they come with. No other manufacturer's tubing set or tubing sets from another size of balloon should ever be used. On the Arrow style adapter, you need to remove the protective plastic cover. You can check the adapter matches the balloon volume by reading the volume from the adapter. Note the difference between the Arrow adapters and the Datascope adapters. The pink balloon adapters are universal for the Insightra balloon. Always connect pink to pink. The adapter is secured by turning clockwise. All connections should be tight. Take the pump adapter and securely fix it to the pump in accordance with manufacturer's instructions. 7 French balloons are extremely tightly wrapped. This means that during the first purge, the balloon sometimes may not unwrap fully. If this occurs, a second purge cycle may be performed. If the balloon does not unwrap fully after 2 purge cycles, a manual fill with helium can be performed. On Datascope machines, helium can be placed into the syringe using the manual fill valve. Check the instructions for use for the volume of helium for each balloon for a manual fill. Connect the helium-filled syringe to the gas tube of the balloon and perform a full manual fill. Remove all helium at the end of the fill. Disconnect the syringe and connect pink to pink for the gas line. Connect the helium tubing to the machine. In some circumstances, you may wish to do a manual fill with a sterile technique. Take a sterile 3-way stopcock. This portion is now sterile. The syringe can be loaded with helium as described earlier. Note the syringe is non-sterile. The syringe is connected to the sterile 3-way stopcock. The manual fill is performed and the helium withdrawn. The sterile 3-way stopcock is removed by the clinician, leaving a sterile pink connector. A sterile pink to pink gas connection can be made.